Welcome back, everybody. Just wanted to introduce our next speaker. Her name is Deanna. She used to speak for us in the past, gave us tips and tricks on our resumes. She is a practicing PA that also works on many different organizations, including the AAPA Board of Directors and the Director at Large. She's in the Maryland Academy of PAs. She has a lot of experience and a lot of good tidbits on how to work on your resume and what to do in the future. So without further ado, here is Deanna.
Great, thank you guys. And can you make me the hosts or a co-host so I can share some background so you don't have to just stare at my face for an hour or whatever. So hopefully you are caffeinated and fed and bio breaks and all the other good stuff have occurred for you. And then just let me make sure you guys can see the slides okay. Or are you seeing the presenter view? You're good? Okay. So, and it's advancing for you guys. Thumbs up? Yes? No?
Yes. Yeah.
Perfect. Okay. I just like to make sure until I'm halfway through and then realize you guys have been staring at one screen. All right. And I'm going to turn closed captioning off because I talk really fast and it doesn't keep up. So please feel free to interrupt if you want. I have no problem with going on tangents. I think that's where we sometimes learn best. So as it was said, I work in Maryland primarily, but I'm also licensed in Pennsylvania. So I split my time between an emergency department and a county health department, working in a family planning sort of clinic capacity, and then also do some psych on the side. And previously I worked in urgent care and primary care. So lots of jobs, lots of not so good jobs, some really good jobs. So learn from my mistakes. And I just say, there's a couple of us talking today. You'll get 20 different opinions on the right way to do things or the best way to do things. So you really have to decide what fits best for you. And what works today may not work in the future, and what works in the future, you might have said, oh, I would never do that. And then you end up doing something. So kind of keeping some of these ideas in the back of your mind can be helpful, because it's rare, unfortunately, these days that we stay in the same job, that we actually, you're seeing the presenter view?
Yes, sorry, Deanna. We are seeing the presenter view.
Let me see. How about now?
That's good.
Now we're good. All right. Perfect. Okay, good. No cheating. I don't want you to know what I'm going to say. Okay. So while on rotations, asking for additional experiences, don't hesitate to do that. You don't want to tell people like, this is really lame, or this is really, annoying, or this is boring, or you're not giving me enough to do. But, sometimes there is some interesting opportunities for you. So, sometimes this does mean doing an extra shift or an extra day, but just saying, is there other options? Asking to attend department meetings can learn a lot from that. You see sort of some of the what goes on behind the scenes, depending on if you're hospital based, asking if you can attend grand rounds or morbidity and mortality. They have meetings pretty much every day. And sometimes you can even just look and they have postings, like they'll have a tumor board meeting or whatever, even pop in on other department meetings if they're available. And often you can just sit up against the wall and just ask permission beforehand. Depending on, we take students only really in the emergency department of the jobs that I have. So our way is that you get with all of the PAs, but you're only with the PAs theoretically. But whenever I have a student with me, I always say, like, as soon as you come on shift, you talk to the charge nurse and you talk to the doc and you say, hey, if you see anything cool, please keep me in mind, come grab me. So feel free to do that and advocate for yourself. And then say, like, hey, is there other opportunities you think I should be aware of? Should I kind of rub in and get in with somebody else and take an opportunity with that? Because that can absolutely be something that can be really beneficial to your learning experience, is seeing how other people interact in the same setting or in different but related settings. One of the biggest things, and I've heard this from students, is don't say like, oh, I could never do this. Like, no, A, you don't know, and B, we know people. So, you don't want to kind of crap on our rotation. This is what we do every single day. So sort of say, like, well, I'm really exploring my options, or I think I'm best suited, or right now I'm most interested in, but I'm excited to learn. Keep those options open. But also at the same time, don't lie about things. So if you're like, I kind of get lightheaded around weird smells, I want to know that before I'm picking you off the floor. So if there's something that you're really uncomfortable with or something that is triggering for you, let us know too. And you don't have to necessarily go into history, but you can just say like, for this type of patient, I would like to step away, or I might need a moment or something like that, because you need to advocate for yourself too. While at the same time, sort of pushing yourself. We all have a body part or a thing that we just can't handle. A peer of mine can't do toenails, like that is his thing. He will pay anybody any amount of money if there's a toenail thing going on. I'm not a big fan of eyeball injuries, but we do what we have to do. So if there's things that you just really have a hard time with, learn it, but don't hesitate if it's really making you uncomfortable or something to ask for help. And then get letters before you leave. So asking your preceptor, especially if they're like, hey, you've done a great job, if they're sort of ambivalent or they don't give you great feedback, you may not want a letter from them, but ask for a letter before you leave that rotation. Because honestly, when you graduate 6 months from now, I don't remember you that well. And it's really hard sometimes to give you specific feedback based on how you're doing, or write a letter specific to you. Now, the vast majority of larger health systems, the references are often just electronic, do you know this person? Yes or no? Are they a serial killer? Yes or no? And you just kind of move on. But having some of that information is really helpful. So if you write a letter and ask them to just save it, would you mind writing a letter for me and saving it in case I need it in the future? That way, in 6 months, when you come and talk to me, I can pull up the letter and actually remember specific things about you. And this actually happened to me when I was a student. I had a really great emergency medicine rotation, and one of the ER docs pulled me aside and was like, if you ever need anything, let me know. And I was like, awesome. And then I went to graduate a couple months later, and I went back and he wrote me a letter, and the letter was like the most generic letter. It was clearly like his letter. It was just like, student did great, showed up, would hire. And that was it. And I was like, oh, he didn't remember who I was whatsoever. So, really get that letter in the moment when you can. Now, I will say sometimes getting letters from your preceptors early in your rotations aren't as good as later in your rotations, just because you're a newer student. But if they can speak to that, hey, even though this was her second rotation, she was really a go-getter and, really adapted. I could see growth through the rotation and things like that too. And other times you're just so green, it just really isn't going to be a good letter. But you can ask, can you write a letter based on me professionally, or based on me as a student versus necessarily the skills that I had at the time that I was doing my rotation? So while you're on the rotations, don't hesitate to ask questions of your preceptor. Obviously, not just clinical questions, but what are things you wish you had known? How do you wish you would have learned and studied for boards, or just studied in general? Are there things you wish you would have gone back and done differently? But also ask them about the practice environment, especially if this is an area that you're looking to stay into, of sort of saying like, are there employers that you would not recommend in this area? Is there something like everybody knows but nobody talks about? Or are there systems or employers that you would really absolutely recommend working for? And I do want to point out that it's not really sort of known until you ask about it, is that each service line within a hospital system is sometimes a different employer. So what I mean by that is you work for hospital ABC, right? In the emergency department, that is usually a contracted group. And part of that is from a malpractice perspective. Some of that is based on financials and things. So meaning I'm not a hospital employee. I'm actually a contracted group working within the hospital. Same thing like the anesthesia line is its own thing. Same thing that the orthopedics line is its own thing. So you may be either a hospital employee or the subcontracting group employee, or a private practice that just has hospital privileges employee. And those obviously are different employers. And so there's pros and cons associated with that. So asking those kind of questions, saying like, hey, I really like this hospital. And they're like, yeah, but just so you know, it's this actual contracting group, and the contracting group isn't great, even though the hospital is great. Or it might be vice versa. Everybody loves to work for that contracting group, but the hospital itself is having some issues. So knowing those kinds of things, I will say with some of these super big contracting groups, so like USACS and Team Health and Envision and some of these really big ones that are national contracting groups, it is different though, based on the area that you go. So it's a region. So you might say like the Mid-Atlantic component of that is fantastic to work with. And even though a lot of the contracts are the same, or a lot of the sort of navigation or the HR is the same, there may be sort of different flavors based on the hospital or the region that you're sort of working that makes it a better or a worse organization to work for. So I'm going to, give you an example of asking for this and asking, making sure. So one of my clinical experiences, the physician pulled me aside and said, "Hey, if you're interested, I'm looking to expand. So contact me after graduation." I was like, "Oh my gosh, I'm getting offered a job. I'm so excited. This is awesome." Well, it turns out that this person just constantly hired new grads because they didn't know better. And so every 2 or 3 years would hire another new grad. And so one of the other PAs actually pulled me aside and was like, "Let me guess, doctor offered you a position." I was like, "Yeah, isn't that awesome?" They're like, "Don't." They're like, "I'm actually leaving in 6 months. And the person before me left after a year." Like they just kind of churn through people. So this is why it's kind of good sometimes to sort of get that scuttlebutt, get that dirt on what's going on. Also, always ask for feedback. How can I be a better learner? Not just, are my suturing skills okay, or what's my differential, but how can I learn better? Am I asking the right questions? Am I presenting my patients in a good way? What do you think my strengths and weaknesses are? And not just, again, clinically, but also professionally. Sometimes it's a body language thing. It's how you even ask your questions, that you question too much. You need to be a little bit more self-assured, or sometimes you're a little too cocky, and it comes across in a negative fashion. And that's a hard thing to hear, but this is the time to learn, and to learn all of those things that make you not just a better PA, but a better person and a better colleague as you go into the field. And then you hear these things and you think, "Oh Lord," like that, it can really hit you, right? So when you first hear it, the first thing is just try to stay calm as best you can. And, sometimes, yeah, your throat gets a little tight, your breathing gets a little hard, like, oh my gosh. So try to focus on the point that they are making. What is that sort of point that they're really drilling down on? What are they sort of, focusing on, or is there a theme between the comments that they're making? And just ask them for examples. Can you give me an example of where you felt I did that really well, or I did that really poorly? And I would say actually not responding in the moment, because it's hard, to get your mind around it. And of course, your first thing is, "What the hell are you talking about?" Like, I don't do that, or I don't feel that way, or I don't come across that way. So just pausing and saying, "You've given me something to think about. I'd like the opportunity to maybe talk about this further, but I don't know yet." And sort of saying, like, "Is this true?" And then asking, ask your peers in the classroom, from your interactions, ask other family members, and ask them to be honest, or ask past preceptors that you've worked with, like, have you noticed this, or is this something that has come up before? And being very mindful of that as you go forward. Well, what about if that criticism doesn't seem valid? It's something, either it seems more like a personal attack, or it seems like there's some cultural or language issues, or it just is outright not true. I'd like to tell you just ignore it and move on, but we all know those kind of like earworms, like it just sort of sits with you forever, and you're just sort of just kind of constantly stuck thinking about that. And that, it's really hard, to get some negative feedback and try not to take it personally. Do it as best you can, but definitely process it, with other people, and sort of what that means for you, what that brings up for you, and that sort of thing. And, if it's blatantly inappropriate, they say something that is just, wow, like they really cross a line, talk to your faculty, because sometimes this is not you. This is actually, something that this preceptor has done before, or, is an ongoing issue. Sometimes faculty know about it, sometimes faculty don't. And it may be the reason that they don't actually put students with that preceptor anymore. So, talking to them, or they might say, like, you need tougher skin, and that's why I always tell people, prepare for the extremes, prepare for this huge blow up and it becomes some kind of issue and there becomes some kind of testimony thing, or prepare for the opposite, of they sort of tell you to suck it up and that this is medicine and this is being a professional and people aren't great. And but you have to sort of live your truth and find places that you do feel validated. So take that with a grain of salt, and kind of find good places to get that balance that you might need. But recognize that sometimes criticism isn't about you, it's more about the person giving that. So let's switch gears a little bit, and let's talk about sort of, the paper goods, like the handouts and things that you're giving. So there's a interaction here, and it says it's pink, and it says, and they're talking about her CV, and she says, "Oh, and it's scented. I think it gives it a little something extra." So I wanted to know, how old am I? Does anybody know what this movie is?
Best movie ever, Legally Blonde.
Good. I was worried. I was so worried. I was like, oh gosh, this is like a generational thing. I've reached that age. Thank you. Thank you for validating that this is a classic, right? But it's a kind of an interesting point. Like, how much do you stand out? Like, what do you do? So there are so many templates out there, and you can even type in like free medical CV template and it like auto loads and things. A little flair is personable. You want it to stand out, but you don't necessarily want it to be over the top. My big thing with all of those templates is really double check, because you want to save it as a PDF and you really have to watch the formatting, because some of those lines get weird and the spacing gets weird or the graphics don't translate. The reason you want it as a PDF is because a lot of the job posting systems, you're going to upload it. And if you upload it as a Word document, it can go all over the place, but the PDF is a little bit more set. And so it's less likely to look wonky when they upload it. So just save it yourself and double check it before you upload it. I definitely have looked at a CV that they actually had the track changes version that got uploaded, or some really just oddball things that, it clearly still had like the fake words in there because it was obviously a template. So have somebody else review it, even if it's just a peer in your class or a family member. And I am also a fan of having somebody that's non-medical read it over, because we put jargon into things that we don't even realize, especially as you get more jobs and more experiences. So, just sort of processing through that. Continually update your CV. So with every rotation, shift completed to a pending rotations and sort of shorten your lists and highlight things that are unique to each rotation. And this is one of those, like, I covered general surgery, but we covered a burn unit, or, my family practice rotation is a rural rotation in the middle of Montana, and we did a whole bunch of other stuff. I don't recommend that you list procedures, definitely not number of procedures. So don't put like assisted in 6, hysterectomies, because it just really highlights that you're inexperienced. And really just putting procedures in general, I think sometimes highlights inexperience, because we're assuming that when you do a general surgery rotation, you're going to be doing suturing and you're going to be first assisting. Like, that's just a given. But if there's something unique, like you are doing central lines or you are doing lumbar punctures, exposed to lumbar punctures or was able to perform, central lines under guidance or something like that, that's something to add into, or, completed ultrasound, basics of ultrasound or some cadaver lab or something like that. But really putting those, I did 5 of these, I would not recommend at all. The point of the CV is wanting to invite a conversation. You want to put just enough detail that you're interesting, but not so much that they're like, I know everything about you. You want them to call you in for the interview. This is just like applying to PA schools. You kind of want those little nuggets that make you look different than your peers, and then put that out there. And this is where, if you ask for extra, so you're doing a hospice rotation, but you say, hey, can I spend a week in the ICU? You put in there, hospitalist rotation with exposure to critical care patients, you know what I mean? Or something like that, that again, sort of makes that stand out a little bit. And then email it to yourself, keep it so that way you have a copy, because the best thing you can do is when you're doing your networking is they say, oh, shoot me a copy of your CV. And you're like, done, because that really gets, striking while the iron is hot. And also it just has it available to you. And there's definitely been some times where it's like, oh crap, a deadline's coming up and I'm trying to find my CV, but I have one that's fairly recent that I can then use and upload. Now, separate from that, and this is actually something I learned from a mentor, was keeping a rolling list of accomplishments, usually on about a 1-year basis. These are things that maybe don't necessarily make it to your CV, but are things like your brag list, of things that you were involved in. I attended a couple of meetings, or I attended an interesting conference. I co-presented, I worked on a workshop, I precepted, something like that, that this works for when you're coming up for like your annual review, that you're saying like, you should give me this bonus, or you should, up my pay or something like that, because I've actually been doing all this stuff on the side. And this is also a good thing of, what have I done? Like when you're trying to sell yourself to a future employer, or anything like that, of sort of saying like, actually, I've done stuff, and we tend to, in general, really sort of downplay the things that we're involved in. I still am guilty of this. Somebody says, well, what did you do? And I was like, well, actually last week I was here. And I'm like, oh, I actually did a lot of stuff. And none of that ever makes it to my CV or something, but it's important especially when you're saying like, I'm not available to do something. And you want to say, well, this is why, because I've actually been doing all of this other stuff. So that's another kind of thing to sort of keep running in the background. So what about business cards? There's all these cool new digital ones, and like you can have like the little QR or RFID codes and scanning it. not all of us are cool and hip, right? So having a paper card still has a role. And that's for a couple of reasons. One is it's something tangible, and there is actually something about having like a tactile thing. But the other thing, how many times do you write a note on that business card of like, this is that person, or, you want to add something to it. It also legitimately does make you stand out a little bit when they're, having a pocket of cards and they're like, oh, look at this kind of cool card. And these are just some examples. I use Move for mine. They're a little pricier, but they have some really nice templates. Vistaprint though is like $10 for 100 cards. So it's very cheap. It's very quick. It's very easy. So especially as a student, when you're sort of constantly changing what you're doing and different things like that, again, having some business cards is nice. I don't really recommend the like make it home, because you're going to see the perforations on the edges and it actually calls more attention to it being a homemade item. I'd rather you just do a digital one if you're going to do that, but you can even get them at Staples and Walmart and things like that, anything that has any kind of printing capabilities. So I would create one now. Oh, and I see a chat question. Oh, some schools offer business cards. That's awesome. Definitely do that. Free is always great, especially if they will available. That is a great point. So, do something that helps you to stand out, and it doesn't have to be super fancy or in detailed. So this one on the bottom, it actually is just the last name, but it has a colored background. So again, just sort of stands out a little bit, looks a little bit different from all the other ones that might be in the person's pocket. Definitely have to have your email. I would not use your school email for a couple of different reasons. One is the school emails expire or they change to then alumni at whatever. Also, the school emails tend to have wicked hard spam blockers. And so when you're getting recruiter emails and some other things like that, it can be really hard to get past that. So this is a time to have, just a professional email. I will say you have to make sure it's accurate. So don't have your email as like Dr. Jane Smith, PAC, if you don't have your doctorate and you're not yet a PAC, because it's just one of those things that it's a small thing, but then people start asking questions. Well, like, wait, are you a PA? I thought you were still a student. And you're like, oh, well, I'm going to graduate. And it's like, oh, so, just Jane Smith, PA, you know what I mean? Or something like that, and leave the C versus the S off. But, make sure it doesn't have some weird innuendo or lots of different numbers or, something like that. This is a professional email, and you may want it to be a separate email just to keep inboxes separate. I totally understand that too. As far as listing a phone number, you don't have to do that anymore. But my thing is always, if they mistype your email and they get a bounce back and they don't have a second way to contact you. Now, again, this is the advantage of having a paper card, is you can write your cell phone on the card and hand it to them. And sometimes that extra touch, it's a personal touch, right? You're like, you know what, actually, let me give you my personal cell phone. Like it just, ooh, you're suddenly rated a little higher because you got this personal cell phone for somebody, even though it was going to be on the card anyways. But sometimes, it's just that little extra that makes you stand out. So those are some things just to keep in mind with that. Now, I will say that, whenever you do these templates and you type in a medical, they're going to give you all these different options, and they're going to have a lot of them will have two different symbols on them. So another pop quiz. Does anybody know the name of the two different symbols? Whoa, crickets. Oh my goodness. Okay, so the one on your left, and yes, I had to do the L because, we're in medicine and we lose the inability to do left and right, is the caduceus. So the caduceus is actually the motto for the god Hermes. So interestingly, we think he was a messenger god. He was also the god of thieves and travelers. And so but the thing was it was the U.S. Army Medical Corps first adopted the use of the caduceus in the 1900s, but it was actually used even before that, like in the Civil War and things like that, because the idea was identifying them as non-combatants, and it was mobile. So it was these were like the ambulance, the stretcher bearers and things like that. So their idea was protecting them as they traveled with their patient. So that's why they used that logo initially. But then the American Medical Association used the rod of Asclepius. So Asclepius being the first, sort of actual doctor, and the snake on the staff was supposed to sort of protect and offer words of wisdom and all these things. So people in real medicine often frown upon the caduceus because it isn't really medicine, and it's used by paramedics a lot of times and not real doctors. And so again, it's hogwash. Nobody really cares, as noted by like, who knows? We just notice these symbols and that they exist. And frankly, the Army has actually been using it longer than the AMA. But it's one of those like, when people are looking for a reason to pick a fight, that's something that they'll say. And I'll be totally honest, like AAPA logo, when we were looking at logos, this was something that came up of, well, if we use the caduceus versus the rod. And so we just sort of said, like, forget it, we're not going to do anything like that because it's just not worth the fight. But if you're going to pick one, I would just shy away from either one, or like use just a stethoscope or an EKG or, something kind of generic. That way you don't get, people fired up about, well, did you even realize what, logo you're using, unless you're going to have a conversation about it. So talking about conversations, so we're going to talk about networking. So what is networking? How do you do networking? So doing things like this is networking because you're having side conversations, you're going to swap emails, and you're going to follow up with each other. But it's the action or process of interacting with others to exchange information or develop professional or social contacts. So as much as we are, this sort of cyber world and everything, sometimes, that handshake and this passing of a business card and grabbing a coffee or a glass of wine or something like that is still the way that things are done. It's still the way that you find out about jobs, or you know about the job, but the CV actually gets pulled out of the pile and read. So just like with PA school, when you have, 1,000 applicants for 50 spots, when you have 500 applicants for a single position at a hospital, you need some reason that they're going to pull your application out of the pile and actually be read. And often that comes down to networking. So I can't stress this important enough, that to join your state and specialty PA organizations, and join the ones where you want to work. So just because you're rotating or attending school in a different state, if you always want to go to another state, go ahead and join that organization now and ask for the student fees, even if you're out of state. So sometimes in order to get a student fee in a state organization, you have to be attending PA school in that state, but you can often ask because it's, $25-$50 or whatever, like they're just happy to have you as a member. So they're not always going to charge you like full fellow membership rates or something like that. And if you really need it, especially if you're not sure where you're going, you can ask for hardship rates or a waiver, payment plans and things like that. Often it's just an email to the management company and saying, hey, I'm a student, funds are tight, I really want to join your organization because I want to come work to your state afterwards. Do you guys have, a discounted rate or a prorated rate or anything like that? The worst they're going to tell you is no. Right. But, if it saves you some money and still gets those connections, it's often worth it. So obviously the state and specialty organizations often have job postings. Again, they often know who the good employers are, who the less good employers are. And if they have a conference, go on the day of the conference for their exhibit hall. Or just look at their website, because often their exhibitors, their sponsors are posted. And if they're exhibiting or they're sponsoring or they're paying for part of that conference, they're probably actively hiring. So even if you don't attend it, you can look and see like, ooh, this company was in their exhibit hall. I'm going to look at their website. I'm going to contact the recruiter or reach out to them and say, hey, I'm a student. I'm going to be coming to your state after graduation, or I'm going to be working in this specialty after graduation. I'm looking for jobs in ABC territory. Can you connect me with the right people? And this is a way, again, to sort of get your foot in the door and kind of make those connections. And so that state organization where you want to work, look at their board, look at their calendar. Are there events that you can attend? Most places do a virtual or at least a hybrid meeting anymore. So even if you're just sort of lurking in the background, and just introduce yourself. Hey, I'm a PA student. I'm graduating in December. I'm really looking for an orthopedic job in, this major metropolitan area. Sure. You never know who knows somebody on those calls. And the fact, again, that you're showing up and showing initiative by coming to the board meetings, we love fresh meat and volunteers. So, we're going to be all over that of getting you to actually get a job and stay in our area. So, that's a great way, again, to make connections. Looking at the pharmaceutical events. So depending on the state, depending on the event. So these are like the drug rep dinners, right? Like come learn about Pradaxa or whatever the new drug is. Sometimes you have to already be licensed to attend. Sometimes you don't. It just depends. But again, reaching out to them and just saying, hey, I'm interested in attending. Am I allowed to? I'm still a student. There are certain states where you are not allowed to attend any pharmaceutical dinners. So just be cautious of that. So usually asking, and the pharmaceutical rep will know, like, oh, sorry, actually, if you're in the state or going to work in that state, you shouldn't attend one of these events. Face-to-face is best. We've kind of reached this arc where virtual was super cool and now we're all zoomed out. And so doing that face-to-face where you can have a back and forth conversation, but don't hesitate to have a follow-up, say, hey, can we schedule a phone call or a virtual meeting at your convenience? What's your schedule like, so that I can hear about your organization or hear about your experience. We're often happy to talk about people that are legitimately passionate and looking to kind of get started in the field. And I hate that I have to put this in there, but always be on your best behavior. I've definitely been at conferences where the students have gotten just obliterated on all the really nasty, cheap wine and stuff. And that's just not cool when these are potentially your future employers. Once you have a job, okay, but when you're actively looking for a job, yeah, just don't drink or have one drink. Be careful of what you're saying, watch the politics talk, all those good things that you're supposed to be doing. Just pretend that everybody there, that this is a job interview. Still have fun, don't hesitate to have fun and don't hesitate to be passionate about things, but just, know that line and sort of toe that line a little bit. So email etiquette. I get cold emails sometimes or connections on LinkedIn. So I did just want to put this in there. So yes to any time you have a follow-up contact, even if it's a recruiter that you're like, ain't no way. Again, you don't know what other jobs they might get or what jobs are coming down the pipeline in the future. So don't hesitate. If you've given them a card, send a follow-up email and just say, hey, we chatted briefly at whatever event or whatever interaction. As I mentioned, because they're not going to remember, I'm looking for a PA position in this specialty, or I will be graduating at this time. I'm hoping we can talk more detail about what you might have available or what you might feel might be a good fit. And this is sometimes hard when you have no idea. You're like, I just want a job. But you can tell them that. Say, I'm really looking for a job. I'm wanting OR time, or I don't want OR time, or I want something that's 9 to 5 Monday through Friday, or I want something that shifts, and sometimes they can help direct you in sort of different directions. Yes to cold contacts. I don't think there's anything wrong with that. LinkedIn, I think, is obviously the most appropriate for this. But even if you're listening to a really good talk, you go to a conference, you go to AAPA or the state or something like that, and you're like, wow, this is awesome. And they're talking in the specialty that I want to get into, or they're at the hospital I'd like to go into, but also recruiters, so search. And if you find the recruiter for your hospital system, say, hey, I saw this. I will tell you, though, doing a little bit of homework goes a long way. So go to that hospital system, search for their career postings. And, if they say, oh, we're looking for a critical care PA, but minimum 5 years experience, that's when you reach out to the recruiter and you say, hey, I saw you had this position posted, but I don't believe that I meet the experience requirements at this time. However, I'm really interested in this position. Do you have anything else available at the hospital or anything like that? And use that as a stepping stone, again, to sort of open that door. Also following up directly with the recruiter, again, to raise your application to the top of the pile of saying, hey, I just put a job application in. I'm really looking forward to talking to you further about this. Not looking forward to the interview, but just saying, like, can we connect just so I can ask a couple more questions or hear more about the position. I will say, do not just email somebody and say, like, hey, I need a job. Like, you have to put a little bit more effort into it, at least have already applied to something before, or, have some kind of context. It's a little bit of a push off when somebody just is kind of coming up to you and sort of being like, you need to do this for me. No, I'm happy to help you and happy to help assist you. But I need to hear that you've done some of the homework or you're doing some things, even if it's something that you say, I've applied to a couple of jobs and I haven't heard back. Would you mind, or do you know someone who could look over my resume or do a practice interview with me or something like that? Obviously, everybody presenting today, I'm sure, is going to be more than happy to talk to you about this, or know somebody that could. Definitely talk back to your faculty. They may not be able to do it, but know an alumni that could do it for you. So those are some other options to look at. So job alerts, a lot of the major hospital or larger employer systems are also going to have alerts. So not just their posted positions, but you can log in to say, let me know when another position for a PA. I would also say anytime an NP position is posted. There's a lot of pushback about, how interchangeable we are as professions. And some systems will preferentially hire NPs. For example, in my system, in our emergency department, we do not hire NPs in our emergency department, but we hire NPs in other departments, and preferentially in some of our ICUs are NP heavy versus PA. And that's for a lot of different reasons. But signing up for both of those, and then that's when, again, you reach out to the recruiter and say, I saw you post a position for an NP in whatever specialty. I recognize that I'm a PA, but I feel like I could still apply for this position. Because what happens is that you have a practice manager or, a secretary or an admin that basically says, not an NP, not an NP, not an NP, and just tosses out all those other applications. So you want to have another in where somebody says, oh, I know this doesn't meet that basic criteria, they still go to the next pile for actual review. And that's where, again, that networking becomes so important. And this is connecting with the recruiter. So they'll often say, apply now. If questions, contact recruiter at ABC, or, Jane Smith at ABC Hospital. Absolutely reach out to them. But remember, they are an HR person for the most part. They have no idea of all the different letters. They've basically been told, oh, Dr. Jones wants a PA in the ortho clinic, post the job and do the grunt work of shifting through different things. So they may not always know what your credentials are and things like that. And that's, again, where sometimes you say, I recognize this was posted for nurse practitioner, but I feel like I still have the experience or still have the skill set to do this. I'd like to talk to you about it further, and hopefully they'll get back to you about it. I also like the idea of following the practice or the health system on social media. Again, they often have, a lot of them are getting a lot more savvy and doing like public info sessions. So for example, they just had a breast cancer one, or American Heart Association. And this also is a good talking point when you're talking to the recruiter, of sort of saying like, oh, I just caught your thing on this, and I saw Dr. So-and-so or PA so-and-so talking about it, and I just knew this was the kind of organization I wanted to work for. That works a little bit better with administrative people and HR people. It doesn't necessarily work as well with like your collaborating or supervising physician or the other PAs you may be working with, but it still, again, shows that you're invested and puts you apart from your peers that are applying for the same position. But what if you're an introvert? So secret, I'm an introvert too. So these kind of things stress me out. I have to talk myself into doing it. I have to have a game plan and things like that. So sort of sometimes, prepping yourself of sort of having an idea of what you're going to talk about or who you're going to talk to. But sometimes taking a friend. Now, most often in these things, it has to be somebody else in the medical field. So ask your preceptor if they're going to go and then tag along, ask another colleague or peer, another PA student, and practicing your pitch, of practicing, like literally standing in front of the mirror, talking to a friend, talking through it, about, hey, I'm actually graduating in December and I'm really excited to be starting, and these sorts of things. And this is where your passions come through. It makes you stand out as an individual. So talk about the things that you enjoy doing. And it doesn't have to be medicine. You can talk about your really focused on health equity and reducing health disparities, or you're passionate about underserved communities, or you really love women's health. You can talk about that, but you can also talk about how you run races on the weekends, or you rock climb, or you scrapbook, or whatever it is that you do. Those are fun things, and little factoids that you can kind of talk about. Obviously making sure that they're appropriate, for polite conversation. But once you get going, that conversation can kind of flow very well. And if you're stuck, ask about them, right? We love to talk about ourselves. So ask about their own journey. And this can be whether it's a physician or a nurse or whatever. Say, hey, tell me about your journey in healthcare. What did you do before? Have you always wanted to do this? All those kinds of things. And then, catalog some of that information, because sometimes it'd be like, oh, I used to work for Dr. Jones and he is such a blah, blah, blah. And you're like, oh, okay, this is good to know. This is another reason it's really good to be sober, so that as they get tipsier, you get more details about what it's really like to work with certain organizations. But remember that we like to complain, but at the same time, if we're still employed at that organization after 10 years, we're complaining, but we're also not leaving. And there's a reason for that. So either the grass isn't greener, or it's actually not that bad. We've just had a bad shift. But sometimes you can get some good information about a potential employer that way too. All right. You got an interview. Now what? So you freak out first, right? You second guess and you talk about how you're an imposter and, oh my God, you're never going to do this. And then you settle down and you think about like, what kind of questions am I actually going to ask? So why is this position available? So tell me, why did this position come available? And this is really important because you're looking at turnover. Just like I mentioned before, like, oh, every 2 years they're hiring a new PA. That's a huge red flag. Why is nobody staying beyond 2 years? There's absolutely a reason for that. Or are they expanding? We actually have added shifts, or we've changed our shift dynamics, or somebody moved to part-time versus full-time. That again speaks to an organization that's a little bit more stable, and the PAs aren't leaving versus, constantly going. And sometimes it is like, oh, they got a position that they couldn't turn down, or their spouse got a transfer or something like that too. If it's their first PA that they're hiring, that's okay. But sort of ask, well, I'm curious, why now? Why a PA now? Is it they've always had NPs and they wanted to try a PA? Is it the first time they're hiring any kind of advanced practice provider, PA, NP, whatever? Ask them how they envision PAs to be a part of the team. Have they ever worked with new grads in other professions before? We're not all entirely interchangeable, but it's that idea of, how do they handle a new learner in their practice environment? And that's where you get into the onboarding process. Onboarding for an experienced clinician in that specialty is very different from onboarding in a new specialty. So I'm going to give you an example. When I started in the emergency department, so I came from urgent care, and the urgent care we were in was a pretty comprehensive urgent care. We had on-site x-ray, we did IV fluids, we had on-site labs, so it wasn't just like a CVS Minute Clinic where it was only a rapid strep. So it was a little bit more comprehensive. And I went to the emergency department. That was different. I got hired the exact same time as another PA who was fresh out of school. So she actually had a 6-month onboarding process where basically she was always an extra person, so she was a mid-shift or she was an in-betweener, so that there was no pressure on the number of patients she had to see. I had a 3-month onboarding process. And so they said, you already got a lot of the medicine down, but we need you to get more of the emergency medicine part. You have a lot of basic procedures. We need some more advanced procedures down, that sort of thing. So I had a little bit less. And then we talked about like how that onboarding would be. And so one of the things I learned through my onboarding process was it was actually better for me to pick up night shifts. And the reason for that is that that's when you saw more critically ill patients. There was less coverage, so the volumes were higher. So you had to sort of adapt more to doing that. You obviously got to deal with ticked off consultants more at 2 a.m. when you're waking them up and things, but also less services. What happens when ultrasound needs to be called in and you need a stat report? What happens when all these other sort of factors come into play? And it made me a better clinician because of that. But in other places, there is no night shift. So maybe you're not even doing that at all. So what is their onboarding process? Do you spend time in other departments? Do you spend time with all of the providers? And then when I started my newest ER job, it was 4 shifts because I already knew the electronic health record. It was the same one. I'd been doing emergency medicine for 4 years. So basically it was just like, these are some of our processes. Have at it. And I did day shifts for the first month. And then after that, now I'm the dedicated night provider. So, your onboarding can change based on your experience, based on your specialty and things like that. You do want to ask about opportunities for growth, even if you're like, ain't no way, I just want to clock in, clock out, get a paycheck. Like, please, just, I have enough on my plate. You want to know that in a year, 2 years, 5 years, is there any opportunity for you? Because what if you change your mind? And so when we talk about like clinical advancement, so this is advanced training. So for example, if you go into cardiovascular or thoracics, are you going to do endovascular vein harvesting? What's the timeline for that onboarding? So sometimes they want you as like a second assist for a year, then they send you to the training because it's so expensive. Other times, no, part of your onboarding is going to the vein harvesting because they want you to do that from the beginning. What are they talking about? Like floating pacers or doing chest tubes or all these sort of advanced procedures? Or is this a sort of, if you want to, you can, it's sort of up to you. And then what about subspecializing? So even in family practice or orthopedics or anything like that, oftentimes your patient population sort of will change over time just based on who you are and what you're passionate about. But sometimes that can be very intentional. So when I started in family practice, as a young female, all the young female patients came to me and I realized I needed to get real good at family planning. And so I talked to the docs and they were like, absolutely, we would rather not deal with those things anyways. So how about we send you to a conference to get really good at it? So I learned how to do arm implants. I learned how to manage birth control issues a lot more, and things like that. And that turned into my sort of own little subspecialization, even though it wasn't a true subspecialization. But if you work in orthopedics, maybe you actually want to have sort of things on a little bit more sports medicine, or maybe you want to go into kind of concussion management, which sort of is this bridge between sports medicine and concussion and neurology. And you can, again, get some advanced training. It's a niche. It's a good, advertising thing for your physician that you're working with. And it's something that's your skill set that goes with you. So then when you get your second job, you can say, well, not only did I work in family practice, but I also did sports medicine on the side, or I did, osteoporosis management, or I took extra training in mental health and ADHD. And that goes with you no matter what your specialty. It's one of the awesome things about being a PA. The other thing about opportunities for growth is professional. Do you have the opportunity to do any administrative stuff? Are there other things that you can partner with? Are they open to you serving on hospital committees or taking over administrative jobs? Sometimes there's actually jobs out there for what are called inboxologists. So basically all you do is manage like the patient portal and patient questions and reviewing labs and imaging reports. Is there an opportunity for you to work clinically 3 days a week and then 1 day a week do the inbox? What about doing like prior authorization authorizations, or maybe partnering with other departments. In the emergency department, I worked a lot with our county health department before I got hired by the health department. That was purely me, but there's no reason that somebody else couldn't have done that job or been coached to do that job. And you want to sort of ask, are there opportunities for that? How will you be sort of helping support? So you want a job in administration, and guess what? You need to do your time first, right? You can't go directly into administration. And if they're offering you a job in administration right away, there's something wrong with that, because you really need the experience ahead of time. So just be aware of that. You definitely need to volunteer first and kind of get your feet wet, and really need to know state regulations, what's sort of happening both the state, but also the national level, because you're going to be advocating for the profession and really advocating for other people to take those positions after you. Because when we talk about advancement, it's not just you going through the door, it's you holding the door open for somebody to come behind you, and preferably another PA to fill that spot. So we really often need to create our own clinical ladders and administrative ladders. So really knowing everything that we can do as PAs is really important for that. So what if you're not getting a job? Now, it may be the time of year that you're graduating. If there's 3 other PA programs that are all graduating at the same time, or it's med schools, or the residency programs are ending at the same time, it might be the location that you're looking for a job or the setting that you're applying for, and things are just overrun. Everybody's dumping into suburbia at this really good hospital. So you might have to look more urban or more rural. And you really want to follow up, what would make me a better applicant? And if everybody keeps saying, oh, you look good, it's something else. So I would tell you to get new references. Your references may be just bland or lukewarm. So update your CV, change the formatting, change the words that you're using, but consider some other things, changing your cover letter. Look at the medical training that you do have, look at volunteering in a medical capacity at a federally qualified health center, looking at an educational thing. Can you do community health worker, like at your health department or through a faith-based organization? But you really have to watch those limits of your licensing. You can't be giving medical advice if you're not licensed or you're not under a physician. So just know that and kind of use those skills. Really brush up on billing and coding when you're in that limbo position, because that's what's going to make or break your contract. As far as looking for opportunities for you to get more money or bring money into a practice. And it's like one lecture in PA school. So you can always use more education on billing and coding. No, in a hospital setting, you don't get to choose your billing code, but your documentation will up or down code your charts. So again, just listening to some lectures and stuff. And that's, again, something else to talk about. Should you get another degree? I know you guys have another talk on this, but I will tell you, don't just get a degree to get the degree, not just for the alphabet after your name. Some employers will also pay for part of that education. So that's a question to ask as far as that advancement. So I hate for you to take on more debt that you don't necessarily need, and make sure that the training actually matches what you want to accomplish. For now, and you'll hear about doctorates, are really most appropriate for educators and some administrative positions. You don't need it for a ground level entry position, but if you want it eventually, it's something to look at. I wouldn't necessarily jump directly into that. So you got an offer. Now what do you do? So figure out your minimum budget requirements, factoring in your student loan repayments, any cost of living changes based on where you're living, if you have to move and all that kind of stuff. And realize that this whole work-life balance is not a thing, kind of reset some of those expectations and focus more on boundary setting, number of hours, are you on call, out of office requirements, you're going to be doing notes at home and different things like that. And then again, looking at that advancement opportunities, because, sometimes they'll buy down your hours, meaning you have some protected time for administration, and sometimes it's all additional and it's unpaid. And you need to know that for you, what are your own personal priorities? And then give yourself the flexibility to sort of change your mind as you go on. So things you can't change, with large employer groups, it's usually very set contracts with limited negotiation points. I was told, and I think it's such great advice, to ask for the least amount of hours that you can afford, because everybody's always going to be short-staffed. But for that one time that they're overstaffed, and then they're going to send you to Timbuktu Hospital to finish out your hours, or they're going to tell you you owe them time back, or you have to take unpaid leave or something else. So just the bare minimum of hours you can either get the benefits or that you can afford to live on, and then you can always ask for extra hours. Look at those non-compete clauses, look at concurrent employment. So sometimes they'll say, oh, a non-compete, and you say, well, I'd actually like to do a part-time job somewhere else. And they'll say, oh, well, our hospital system also owns an urgent care. That's fine. I want to be able to work at that so that I can transition if I want to. And then you can earn extra pay if you need it as well. Salary negotiations, larger employers have more set benchmarks. So if you're this number of years, this is where your pay starts. I'm always very cautious about using salary data because sometimes it can be very, very limited. So if you're like, ooh, I want to work in psych as a new grad in a state that has really restrictions as far as mental health providers, you're going to find like 2 people that actually completed the salary data for that. So that salary isn't really reflective. So you just need to take it with a grain of salt. But if it's really under or really over, you got to ask some questions about that too. And look at what your actual take-home pay will be, because some of the employers will say like, oh, you're going to make this amount of money, because they roll those bonuses, those benefits package into what your pay is, because they're paying it on your behalf, but it's not actually your take-home pay. And looking at what's really required as far as hours are concerned. What is my baseline hours? What if I work more? What if you don't have enough hours for me? Is my pay going to change based on that? And then the bonus structure, bonus is productivity often based. How is that calculated? Is it practice productivity? Is it my productivity? Is it RVUs? Because this can be hard when you're in surgery and you're doing global visits. So you're seeing all the post-op, those aren't paid visits, but you're freeing up the doc to see another patient or another PA to see another patient, which is bringing income in, but it looks like you just cost the practice money. So talk to the other PAs. You don't have to talk necessarily dollars and cents, but just ask them how they break it down and how that looks in their paychecks. Looking at that initial contract, look at the probation period, that onboarding period. Often they'll say that there's an ability to let you go without cause. And so you just need to be aware of that and ask for a notice. Sometimes you can't get rid of it, but ask if there's ability to terminate, that there's at least like a 30 or 60-day notice. So you get at least another month of paychecks while you're looking. And look at a built-in review time. At 6 months, do we review my pay and productivity? What are those kinds of things? As far as signing bonuses and relocation expenses, they look really good, but it often locks you into a contract, and they often will, if you break that contract, you have to pay it back with interest. And it's often a crap ton of interest, like 15% interest. So, just keep that in mind. I actually have refused signing bonuses because I said, I don't want to be stuck there for 2 years in a really crappy job for $5,000 extra now. Now I can afford to do that because I'm employed now, but I totally understand being a student fresh out of school. So you want to ask for as little, 1-year contract with half the signing bonus or something like that. Just again, because if it's a really terrible job, you want to have the ability to leave as soon as possible. And then again, looking at how often contracts are reviewed. Is it just when you've been a PA for so many years, or is it you standard of living, productivity bonuses, and are there caps on income? So who's the boss? You should absolutely be meeting with whatever physician you're going to have a delegation agreement with. So, I've taken a job where I thought I met the doc, and then I showed up and they were like, oh, actually, that's not the doc on your license. And I was like, oh man, guess what? I was only at that position for 6 months, because that was like the first thing of many, many red flags. So knowing those kinds of things. Often your chair of your department is you listed as your supervising doc, especially like if you're a hospital employee in surgery. The chair of surgery is your thing, but that allows you to sort of go to any of the surgeons, but you should really meet the surgeons that you're going to be operating with the most, if possible, even if it's just a 5-minute meet and greet, just so you can kind of get a sense of things. And you really need to know all of the state hospital and employer regulations. And those can be different, but remember, you have to follow the state is the most restrictive, or follow whichever one is the most restrictive, but you can't violate the state. And this can be chart review, meaning how many needs to be, co-signed. Sometimes it's a peer review process, what the actual supervision as far as on-site requirement, face-to-face access to the supervisor, like, do I need to have their cell phone present? What about substitute or secondary physicians? You need to know the rules. You cannot rely on your HR or practice manager, because again, they are not medical individuals. So some red flags to pay attention to, a really crappy interviewer. And these are all interview things that I've had an issue with. Somebody that didn't really know what a PA role was. I was saying, oh, like, how am I going to see patients? And they're like, well, you're going to scribe. And I was like, nope, like that's not happening. Someone that doesn't support PAs and NPs. I've had a doc where I was halfway through the interview and realized that he never would see me as a colleague. I was always going to be a junior resident, and I did not take that position either. And also, like, you get there and you're having this interview and they're just not invested. And I had this happen. They paid for me me to come. I met with a realtor. It was like this whole to-do. And then I met with the actual doc. He had already decided that he wanted to give the job to somebody else, but he was required to interview so many people. So he clearly was not interested. Luckily, it didn't really cost me anything, but this is definitely, something that's extremely frustrating when you get there. But don't hesitate to, talk to somebody and be like, it just didn't seem like a good fit. Don't take it if it's not a good fit. If there's no malpractice coverage, you really should consider not taking that job. Now, I will say if you are a subcontractor, or you're a 1099, you're going to have to carry your own malpractice. But as a new grad, you should really be getting a job that carries malpractice coverage for you. It should be that sort of cemented. Or if you're carrying your own malpractice, they need to be either reimbursing you or your pay needs to be higher to cover for it. It's going to be a minimum of $5,000 for a year of malpractice. Depending on your specialty in your state, it could be a lot more. And then looking at if they say there's no support, they're like, oh, you'll be seeing people, right away. You want to watch for that. Look at that onboarding process and make sure it's in writing. And then no written contract is a big red flag. So malpractice information, just keep in touch of your malpractice coverage for forever. Keep a copy of it, just scan it and email it to yourself. Consider getting your own coverage. I carry my own just because I have multiple employers. It's pricey, but I'd rather do that than be left kind of out to dry. And then just a last few slides here. So I'm a big fan of showing up a little bit early and sort of hanging out in the waiting room, just see how the flow goes, see how people talk to one another, see how the staff interacts with each other. That gives you an idea for sort of the feel of the department or the place that you're working. Always talk to the charge nurse, or the practice manager or the unit clerk. They actually run the show. They know what's going on. They know where the dirt is. Just say, how long have you been here? Tell me about it. What's it like? How do they treat their PAs? And you can tell by what they say or what they don't say. You can look at internet reviews, but know that nobody ever posts about positive experiences, but you can see if there's any sort of pattern of negativity. And then talk to others, and don't be afraid to talk about salary. It's a sticky point of saying like, oh, they're only going to pay me, $100,000. And then the person next to you is like, I'm getting 60,000, but it depends on specialty and location and all those kinds of things. So, but don't hesitate to say like some of the basics of how that contract is sort of written out. When you start, make sure that you have safe places and people to vent to. Just be careful, venting to colleagues when you're new. You don't know who to trust always. Remember that the employee assistance programs exist and utilize them. It's tough adjusting as being a new grad. Finding your tribe, and it may not be at your job. It may be, organizations like this, friends that you've made through school, and sort of connecting with the people that you can trust to give you a good opinion and feedback. Be very careful with new staff. Nurses and staff can make or break your experience, but remember that there is a hierarchy and a rank order, and you have a really delicate line to walk. So, go out to happy hour, but don't necessarily hook up with them. Like be careful in what you're doing, especially as a new grad until you sort of learn your footing. So that is all that I have. Email, please feel free to shoot me an email at any time. I always tell people, and I'll put it in the chat as well, so you can just copy and paste it. Happy to talk, happy to review your CV, do a practice, whatever, whatever you need. I'm here for you. And whether that's professionally or you're looking at getting involved, in AAPA or your state or something like that, please, don't hesitate to reach out. This is a networking opportunity too. So I know that was a lot to go over. Any questions, or are we all just needing another bio break, or what do we got?
So we'll have like another 10 minutes of the questions and answers, and then we'll take a nice 10-minute break. But I think Sedma has some questions written down for you.
Yeah, fire away.
While I ask these questions, if anybody in the chat wants to go ahead and ask their own, you're more than welcome to, or you can just unmute whenever you'd like. First, I just wanted to ask about your own personal journey as a new graduate PA and the major struggles that you faced that you wish that you were like, oh, I wish someone was able to tell me this information beforehand.
Sure. Yeah. So I took a job in family practice, and the reason that my position was available is because one of the PAs actually had gotten a new position overseas. And so he was leaving and I was going to be a replacement. And they were, really, it was a neat family practice, and that they were like, they still did hospital rounds, and they had only just stopped delivering babies, and they still covered a nursing home and stuff, but they were slowly they were, selling out different components, and were just coming back to family practice. And so they were older, the docs were all older, and the PAs were all younger. So the docs were all in like their late 50s, 60s, and the PAs were all like under 35, which made a little bit of an interesting dynamic. The tricky part was I was the exact same age as their son, who was currently in PA school. And so, the first year it was great, super supportive. At the end of like at lunch, and then at the end of the day, that we would sit down and go through every single patient chart of who I had seen, and just like, who did they do? What did you do? Like really good feedback, which for the first 6 months was like amazing. At the first year, it was tiring, because it was like, I'm coming to get you when I need something. And now it's getting a little, suffocating. And that was a hard, transition for me of, when do I feel like I'm a grown up, and like, when can I start to push back a little bit? And so learning to navigate that, as well as just this whole imposter syndrome of like, I'm going to kill somebody, I think is part of it. And the other thing is, when you come out and somebody questions you and is like, well, that isn't what Dr. Joe would do, you immediately become defensive, because you're like, but I read the book, and this is something that I know. And growing as a person of being like, okay, you want to talk to Dr. Joe? That's fine, and sort of checking your own ego of the door of being like, if they don't want to believe me, or they don't want to trust me, okay, it doesn't mean that I'm not competent to do something. And I'll be honest, like, it literally happened to me last week, where somebody's like, well, when is the doctor going to see me? And I was like, that'll take you another hour or two, but I'm happy to get them. They're like, oh, it's going to be that long. And I'm like, nope, you already pulled that trigger. I want you to make sure that you're comfortable, and I'll get them, and they'll get to you when they can, and you asked for it. That's what you're going to get. Cause I don't want to say that, oh, they dragged their feet, or they didn't. No, it's just going to happen. So just kind of recognizing that it's not about you sometimes, but then still coming home and crying about it at the end of the day, because some days just suck. Yeah. Other things?
So, so I see that setting the boundary plays a huge role when it comes to just like even professional work, especially as a PA, and being just like a new, not a new profession, but more so an up and coming profession, being so young within the years. So with that being said, how is it like to set the boundary between your staff, where you, like you said in the last few slides, you were just like, yeah, you can go out to drinks with them, don't sleep with them, but also like, remember, you're going to be telling them to do certain things at times. So how do you have that balance between them?
Yeah. So, and this was actually one of the things that I think the family practice docs really sort of pressed in me, is that my birthday was coming up, and they're like, we want to like give you a cake and stuff like that. And they said, just remember how much more money you make an hour than they do. And it was like, ooh, like them buying me a cake was a huge thing, versus me picking up some donuts is not a huge thing financially. And so I'm just always very mindful of, I always tell them, I don't need anything for my birthday. Let's just have lunch together, or, do something like that. Like, just being very mindful of those kind of boundaries, and respectful of that. I'd never talk about my salary in front of the staff. Especially there's one of these docs that complains. He's like, I'm working, 4 of the next 5 days. And one of the other girls is just like, I'm on day 12 of 14. So, because that's what she has to do to keep a roof over her head, so being very mindful of those kind of things in the company that you're in. So if you're going to complain about certain things, making sure that you're with people that are specifically your peers. Again, I think it's absolutely fine to, and encourage you to make friends, go out to dinner, go out to drinks. And eventually some of those individuals would be absolutely some of your best friends, but giving it a little bit more time, versus just like, I want to be friends with you, and things. I'm a huge believer in like chocolate for everybody. I buy pizza, I bring in donuts, at least once a month I'm doing something for the staff, because that way, when I do ask for something, like, it's in the context of like, okay, she's not, I do my own splints. I clean up my own after my suturing, like I police my sharps, those kind of things from a safety perspective, but also from a, like, we're in this together. And it also takes me 5 minutes to put a splint on. Why would I pull you from a task to put on my own splint? Like, I'm just going to do it and be done with it. And that way the staff is really helpful. Or if another doc is asking them to do something, I'm like, come on, we'll go do it together. Like, I'll help you. Same thing, like when the paramedics drop somebody off, I'm in the room getting the story from them. I'm going to help them transfer the patient to the stretcher. And they're like, oh, doc, you don't have to do that. I'm like, first off, not a doctor, Second off, I'm getting the story from you. I'm also assessing the patient as we're doing this. I'm asking some other things that I wouldn't have gotten if I would have gotten this story third hand from like the 4th nurse sign out. So, stepping in and kind of that, but the nurses see that too, of like that you're willing to help them roll a patient to change them, or, grab a patient a urinal or whatever. So some of those things go a long way.
For sure. Sounds working synergistically with the team is like plays a huge role in it.
Absolutely.
On the last question, Amanda is asking, do you recommend including the names of your preceptor under each clinical experience on your resume?
There's no need to do that, especially when you're doing something where you have like 6 quasi preceptors. I would just put like emergency department at ABC Hospital, or the name of the practice, like John Brown General Surgery or whatever, and put like the city and the state. And your references are available upon request, goes on your CV. Don't put your actual references, because the other thing is you really want to get like 6 people that could be your reference. Pick the 3 that are most applicable to the job that you're applying for. So if one of your references is a general surgery, and then 2 are family practice, and then 1 is emergency medicine, and you're applying to like a hospitalist position, you're going to pick and choose who's going to give you the best reference based on the skill set that they saw for you. And that's why you just want to say upon request, because it's going to change. And the other thing is you don't want them cold calling without you giving a heads up and making sure that they're still okay. They're not out of the country or something like that too. But sometimes the less detail is better on your CV. And once you're done school, once you got your first job, a lot of that's going to disappear. You're just going to say rotations in surgery, blah, 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 blah. You don't need to list the individual rotations, and you absolutely don't need to put the preceptors after your first job. Yeah, good question.
All right, so that's the end of our Q&A. Deanna, if you're okay, people can email you if they have any further questions. Now we're going to take a nice little 10-minute break, and then we'll come back for our next speaker.
Thank you guys so much. Have a great rest of your afternoon.
Thank you so much.